Hello, my name is Christoph Schnelle. I'm a PhD student at Bond University in sunny Australia. My co-authors and I have been taking on a big question. We're wondering how to improve healthcare. Most healthcare interactions consist of a doctor, a patient, and an intervention. The intervention has been studied enormously, but there hasn't been really much investigation whether the doctor, or in this case the surgeon, actually makes a difference. And this may be an important question, because if you have emergency surgery, you normally have to go with the next surgeon available. But if you're about to undertake risky surgery, where you can choose your own surgeon, what will you do? Will you actually look to see that you can have the best surgeon available? And if you do, you could ask your GP or primary care doctor, or you could check on the internet for a comparison site among surgeons. But how sure can you be of the answer? We, the authors, actually looked into this a little deeper and wondered if there is a simple proxy for quality. And the answer was no. No simple one. More experienced surgeons tend to have better results than those who only do a few operations a year, but there are still differences in outcomes. What about looking at outcomes? That would be obvious, but it can be misleading, as both surgeons and patients can usually select each other. A surgeon who specializes in emergency surgery can be much better, but have a worse record than a surgeon who only does uncomplicated cases on mostly healthy patients. Therefore, we looked at whether there is a difference between surgeons even after accounting for all known information, including patient risk profile, hospital effects can make a big difference, and surgeon demographics like the number of operations they did or whether they have particular certifications. To do that, we looked through in a systematic review slightly over 10,000 studies and found 52 studies that did precisely this investigation for a surgeon's effect on patients' physical health after accounting for all known factors. And what we found is that there can be large differences in outcomes between surgeons, and this difference depends on the outcome measured, for example mortality or reoperation rate, and the type of surgery undertaken. Another key to finding differences between surgeons was also how much was measured. The difference between surgeons is smaller if only either mortality or length of stay or infection rate or reoperation rate was measured, but larger if a measure included all four of these. In other words, the more opportunity a better than average surgeon had to distinguish themselves, the more there was a difference among surgeons. In addition, we found a number of outliers, surgeons who are exceptionally good, even after accounting for all known risk factors and all known other factors. It might be interesting for future research to find out just how those exceptional surgeons differ from their peers. But it is certainly useful to know that these differences exist and they have been measured, and there is research for that already available, and one can go back to the sources and look at that research. Thank you.